Hello, I'm your doctor. My name is Dr. Raymond, and how can I call you? And I want to know your age as well. Good evening, doctor. My name is Chia, and I am currently 60 years old. May I know why you are admitted to the hospital? And do you have any difficulties? Yes, doctor. I had pain in the right side of my thigh, and I have difficulty walking. Okay, so do you have any additional complaints, like let's say fever, chill, or weakness, or you have poor appetite, you cannot eat well? Yes, doctor, I had chills, I had fever, but recently I had fever only in the evening with 38 degrees Celsius temperature, and also I had poor appetite. I cannot eat well. Okay, so may I know your history for this illness, like what causes it to have pain and suddenly come to the hospital? I got a tattoo 1 week ago, and after I got the tattoo for 2 days, I had swelling and pain on the right thigh, and I did not do anything to it, and after 2 days it happens with fever, and it becomes more and more serious, and I still do nothing. And after that, till recently, I went to the hospital because I couldn't walk. So now I'm going to ask you about your past health history. So, do you have any gastric ulcer before? No. Any allergies? No. Have you done blood transfusion? No. Do you have any inherited diseases? No. Do you have like TB, stroke, or myocardial infarction before? No. Have you smoked before or done any drugs before? Yes. Do you have diabetes mellitus? Yes, I had diabetes for the past 34 years, and I've been taking insulin for 3 years, and also the dosage is 3 ml through subcutaneous. Have you done any operations before? Yes. So just to reconfirm with your information, you had 1 week ago you had a tattoo, and 3 days ago you had pain and swelling, and 2 days ago you started to have fever, which is only in the evening, 38 degrees Celsius, and normal in the morning, and you smoked, took drugs, and also had diabetes for 34 years, and took insulin as medication, and also you done appendicitis operation. I suspect that you had an infection, or it can also be because of that you smoke, and that could be a contributing factor also. Yes. So for now, I'm going to do objective examination or general inspection for you. So I'm going to measure your blood pressure, your pulse, and I'm going to touch all over your body. And if you have any pain while I'm doing any procedures, please let me know. So I've checked your vitals, and everything is good. Your breathing is good, your pulse rate is good, and your blood pressure is not high. You had a fluctuation test positive, which may indicate that the site of injury may contain fluid. The size of your right thigh is 10 cm bigger than your left thigh, which may indicate edema. Do I need to undergo any treatments? For now, we still don't know the diagnosis, so we need to undergo further examination for your diagnosis. Doctor, so what is needed to complete my diagnosis? So for now, we need to do a lab test to find out the white blood cell number, the white blood cell count, so that we can know that if there is any inflammation in your injured area. We also need to have the x-ray for your right thigh and also the ultrasound of your right thigh, because we have to know if there is fluid in your injured area of the right thigh. And there might be a chance of having a surgical intervention if there is presence of pus. We have to puncture and also aspirate the exudate. So for your final diagnosis, we found out that there might be bacterial infection in your right thigh, which is in a purulent stage, and we have to surgically remove it. And it is called Phlegmon. So how is the surgery going to start? And I want to know how is the treatment done? Now you have to sign this informed consent to further proceed this procedure, as this surgical procedure might need spinal anesthesia on you, and the treatment would be by antibiotic therapy by penicillin, and also painkillers like ibuprofen will be used. Okay, thank you, doctor. For the antibiotic therapy, we suggest to use penicillin because it can fight against gram-positive bacteria, which is like Streptococcus and Staphylococcus. Painkillers such as non-steroidal anti-inflammatory drugs like ibuprofen is used as a good antiplatelet drug after the surgery, because the suture will only be applied on the right thigh after 1 week, which heal by secondary intention. The patient was also asked to take care of his diet and exercise regularly due to his diabetes. For the surgery, we use simple aseptic technique, which should be done by the physician and also on the site of patient's wound, like proper hand washing. Handling of surgical instruments should be taken care to reduce infection. Prepping of the physician by wearing surgical gown and also sterile gloves should be taken care. Electrical and electronic devices should be also wrapped properly, and also prepping of the wounded area. Draping is done by the patient's leg raised up to apply the cloth around the leg, and at the lower leg, cover them with sterile cloth and bandage it until the foot. Here, spinal anesthesia is used for this surgical procedure to numb the lower limb. It is applied on the back with sitting position in the intercostal line, which is in between the two iliac crests in lumbar 4 to lumbar 5 interspace. Here, passive drainage is used by using rubber. After the surgery, the wound is not closed and it is intended to heal by secondary intention.